Hello and welcome back. In today's video, we are going to be taking a look at personality disorders and somatoform disorders, focusing on the different symptoms and how we can differentiate between them in making a diagnosis. Let's go ahead and get started with these personality disorders. There are a lot of different personality disorders that we're going to look at today, and they fall into three major categories. We have our odd and eccentric personality disorders, our dramatic and erratic personality disorders, and our anxious and fearful personality disorders. The idea behind personality disorders is that they are enduring. They are long-lasting aspects of a person's personality, as opposed to other psychological disorders that are onset or show up at some point in time. And like other personality traits, these are going to be very consistent, and we will see these show up from scenario to scenario with the same individual, as opposed to only seeing these traits emerge every once in a while or sporadically. Let's go ahead and start with our odd and eccentric personality disorders. There are three different personality disorders that fall into this category. The first is paranoid personality disorder. And with paranoid personality disorder, what we're looking for here, the symptoms, are going to be someone who is consistently suspicious of others, very paranoid, always on the lookout for abuse or trickery from other people. As a result, they may even go to lengths to pick fights with other people because they constantly believe that others are out to get them. Schizoid personality disorder is when a person has difficulty in forming and maintaining close relationships with other people. Essentially, they have no real interest in forming those close relationships. We refer to this as non-social behavior, someone who is not interested in being social. This is important, as later we'll talk about antisocial personality disorder, which means something very different in psychology than it does when we are using the word antisocial in day-to-day conversations. If we're saying that someone is being antisocial, what we often mean is they are not socializing. In psychology, antisocial means something entirely different. But our final odd and eccentric personality disorder is schizotypal, and this is like a mild form of schizophrenia. We might see a person with magical thinking, superstitious beliefs, and perhaps even aloof and indifferent. Our second category is the dramatic and erratic personality disorders, and here's where we see antisocial personality disorder emerge. And when we mean antisocial in psychology, we mean anti-social, someone who is against society. This would be an individual who breaks rules and laws with very little regard to the welfare of others. They may use other people for their own personal gain and feel very little guilt or remorse for their behaviors. Borderline personality disorder is another very common personality disorder, where we see unstable emotions and occasionally erratic behavior. A person with borderline personality disorder might also exhibit unpredictable aggressive behavior and other times promiscuity. Histrionic personality disorder is looking at overly dramatic personality traits. A person who shows intense but often false emotions. These fake emotions are often used to manipulate others. These false emotions are often used to manipulate others. And narcissistic personality disorder is someone with a very grandiose sense of self. It is less intense in the emotional part, but more matter of fact that a person believes in their own superiority. And that is the focus of many of their conversations, because it is built on the belief that they are in fact better than everybody else. And our final category is anxious and fearful. And in this personality category, we see avoidant personality disorder, where a person may avoid others, not for lack of interest, like we see with schizoid personality disorder, but instead someone who avoids those interpersonal interactions for fear of criticism. Dependent personality disorder is someone who constantly needs to be with others for fear of abandonment or being left alone. And obsessive compulsive personality disorder is like a mild form of obsessive compulsive disorder, but instead of anxiety-producing thoughts that lead to potentially irrational compulsive behavior, a person with obsessive compulsive personality disorder is going to be overly focused on work and details, so their obsession is more on day-to-day tasks. So those are the three different categories of personality disorders and the different disorders that fall within those categories. The last thing we're going to look at today is somatoform disorders. And this is a unique category of psychological disorders where a person's psychological state will manifest into physical symptoms. So consider a person who has severe depression or anxiety or anything that will show up in physical symptoms in a person's body, where they might wake up one day and have blindness or paralysis, tics like Tourette's syndrome, or unable to move an arm or a leg. If there's no other medical explanation for why a person is experiencing these symptoms, it could be a somatoform disorder. Conversion disorder is a type of somatoform disorder where it looks like the cause should be neurological, but there is no neurological explanation for the symptoms that we see. Typically with somatoform and conversion disorder, by treating the underlying psychological disorder, those physical symptoms will resolve themselves. But the challenge is, we first have to rule out any other possibility for why a person is experiencing those symptoms. They might have to go through a battery of different medical tests to make sure that there's nothing else that could be explaining why their physical symptoms are showing up. After that has happened, then somatoform and conversion disorder may be used as a diagnosis, and treating the underlying psychological disorder might allow for the treatment of those physical symptoms. We don't see somatoform and conversion disorders that often, but they are possible and there is treatment available for them. We're going to go ahead and stop here for today, and in our final video on psychological disorders, we're going to take a look at schizophrenia and dissociative identity disorder. After that, we'll start moving into the different treatment options that are available from the different psychological perspectives. Thank you so much for watching, and as always, remember, be kind to your mind.